Although I love to explain complex questions and review them a little bit and break them down, but let's not forget the basics of phlebotomy. Let's start off with our tourniquet. We know that the purpose of a tourniquet is to restrict blood flow so that the vein could engorge to become bigger so we can see it. We are supposed to leave a tourniquet on for 60 seconds, no longer than a minute. When we place a tourniquet on our patient's arm, it's supposed to be 3 to 4 inches from the venipuncture site. If you leave the tourniquet on way too long, it can cause hemoconcentration. Placing the tourniquet on too tight can cause petechia. What is petechia? Petechia are capillaries being burst underneath the skin, but what you can see are the red spots at the venipuncture site. Now our needles. A straight needle is to be held at a 15 to 30 degree angle. A butterfly needle, also known as a winged infusion set, is to be held at a 10 to 15 degree. Know when to use a butterfly needle versus a straight needle. A straight needle comes in 21 gauge, 22 gauge, and then you have your butterflies that are at 23 or 25. We'll use our smaller gauge needles, which is our butterflies, usually on the dorsal or for a geriatric or a pediatric patient. Now, when you use your straight needle, it's usually on a healthier, plumped vein. What does inverting mean? Inverting is when you gently mix the blood with the additive. Okay? What tubes contain additives? That's your light blue, you have your green, lavender, and your gray. So that's sodium citrate, sodium heparin or lithium heparin, EDTA, sodium fluoride / potassium oxalate. Let's not forget our clotting activators, which tubes require to sit at least 15 to 30 minutes, approximately 30 minutes, in order for our blood to clot. And of course, that's our SST, our serum separating tubes. So any tube that has the gel at the bottom, let it sit before you put it into the centrifuge to spin and give us serum. What about our discarded tube? You know, the one that you throw away. I like to call it the boo-boo tube. I made a mistake, so I'm going to use this particular tube.